These are Genesee coronary graft markers, designed to support clear graft identification and confident long-term follow-up after bypass surgery. Used during coronary artery bypass procedures, these markers help clinicians quickly and accurately locate graft sites during follow-up imaging, even years after the initial operation. Each marker is engineered with both visibility and handling in mind, giving surgeons flexibility based on graft location and procedural needs. Proximal markers are made from implantable grade radiopaque silicone. They're soft, flexible, and designed to conform naturally to graft anatomy, helping reduce mechanical stress on the vessel while maintaining clear visibility during follow-up and re-operation. This flexibility makes them particularly well-suited for proximal placement, where preserving vessel integrity and achieving a natural fit is important. Distal markers are made from implantable grade stainless steel, offering distinct radiographic visibility under fluoroscopy. Their rigid structure supports precise placement and consistent identification, with optional holders available to support ease of handling during the procedure. Together, these markers help reduce fluoroscopy time, limit contrast use, and streamline graft identification, supporting procedural efficiency and improved follow-up experience for both clinicians and patients. Genesee coronary graft markers, designed for clarity in follow-up and confidence in every procedure.